Hello ladies and gentlemen, my name is of New Patient Group and want to talk to you today about the 6 steps to the new patient telephone call and give you a quick overview of our dental receptionist phone script. First I want to say a phone script is only a script until you know it. It's far more important to understand the philosophies behind the script than it is just to have a script sitting in front of you. And the 6 steps you're seeing each have a very specific purpose in order to improve customer service, efficiency, and also teach your receptionist how to remain in control of the consumer on the telephone at all times. Anytime you're in control, you always vastly increase the chances of getting what it is you want. Now, one of the things that we teach, and it's very important whether it's us or somebody else that you utilize, is finding commercial experts that specialize in role-playing and training. A script is completely worthless if it sits by the telephone and your people do not know the philosophies behind it. It will not do its job. The trick is role-playing rigorously to the point where the philosophies are embedded in the brain of your employees to where they use this script and it now is a flowchart. It is to let them know where they need to go next regardless of the position the consumer puts them in. They are always able to overcome it and go on to the next step because they have a philosophy in their head of what they're trying to accomplish and why they are trying to accomplish it. The 6 steps that you see are the greeting, identify, transition, schedule, data capture, and education and confirmation. Quickly, the greeting. If you are going to a 5-star hotel to get customer service training or telephone training, one of the first things they will teach you is the greeting by all employees is exactly the same. Now, that is far more important than exactly what that greeting is. The only thing that you have to do it under no circumstances can you not is the person answering has to say their name. We do a lot of mystery calls where that does not happen. So worst case scenario, they must say their name. Now, the greeting that we suggest is just the name of your practice, the name of the employee, and how may I help you. Something extremely short. New patient group, this is Brian. How may I help you? And when you answer that call, you should sound enthusiastic. Looks like you're having a good time. And it immediately puts a good mood into the consumer's mind that's on the end of the call. The next one's identify. You are taught how to listen. You are taught how to write, think, act, etc. Nobody teaches any of us how to listen, and it's a very big problem in healthcare and really any place because we've all been in a position where you've called an 800 number before, any number for that matter. You've told the person that answered the phone your problem or what you're looking for, and they end up transferring you to a department that can't help you. And that's just because they never listened to one word out of your mouth or they only listened to half of it and thought they knew what you were talking about. So identify the call is really just sit and listen. And it really is intended to customize the rest of the call to the consumer needs that you've identified. The next one is a transition. That is a transitional statement, and it puts you in charge of the conversation, something that we teach very heavily on the telephone, or transitional statements to remain in control. That statement is also intended to gather proper data that's critical to the success of your practice, and that is finding out where patients are hearing about you, and we embed that into a transitional statement. The next one is scheduling. The reason why that comes first is because it's a customer service reason. People are very uncomfortable giving out personal information until they've committed to something. The last thing you want to do is make anybody feel uncomfortable on the phone. So you want to try to dual close on the schedule first. There's a multitude of methods that we teach as far as dual closes that vastly improve the efficiency of the schedule and allow you to control the schedule at a much higher level. Data capture, that is where you're going to get critical data that you need in order to schedule that patient. And the last one is education and confirmation. There's some things that we teach here that vastly reduce the chances that that consumer to-be patient is going to no-show or late cancel on you. And it also is intended to put more value on what it is your practice offers than anywhere else they have called or might call in the future. Now, when you combine that all together, it is a very, very concise script that, again, is intended to be a flowchart with role plays and staff training. And there is a lot of training that go into each one of these steps, and that's where our commercial experts come into play to ensure every step is implemented properly into your practice. And we want to convert as many patients that call your practice as possible to increase your new patients and also increase your bottom line revenue, etc. Thanks for listening today. We'll talk to you soon.